Confidence NCLEX Review. My name is Professor Humphrey. Today we're going to be talking about diverticulosis. Diverticulosis is one of the topics that is highly asked on NCLEX. Now, so somebody may ask, what is diverticulosis? And diverticulosis basically is an outpouching of the colonic mucosa. Outpouch of colonic mucosa. The mucosa of the colon has outpouch. Now somebody may ask, what are the risk factors? Now what causes diverticulosis, or what are the risk factors of diverticulosis? The main risk factor of diverticulosis is chronic constipation. So anybody who is chronically constipated, they are at risk of diverticulosis. Now, we know that one of the things that can cause somebody to be chronically constipated is low fiber diet. Therefore, anybody that consumes food with low fiber content, they are at risk of developing constipation and also diverticulosis. And also, if you don't drink a lot of water, decreased water intake can also predispose you to develop constipation. Anybody who is chronically constipated, they can develop diverticulosis. So what is the pathophysio? Now, if you are chronically constipated, chronic constipation increase pressure in the colon, and the pressure in the colon causes the wall of the colon to outpouch. So one outpouch is called a diverticula, and several outpouch is called diverticulosis. So therefore, it is the constipation that increases pressure in the lumen of the colon, and that causes outpouching of the mucosa. Therefore, when the colon outpouch, now around the colon, around the wall of the colon, you have capillaries that surrounds the wall of the colon. So therefore, when the mucosa outpouch, it causes blood to leak in the colon and cause the person who is experiencing diverticulosis to experience what is called lower GI bleed. So one of the main signs and symptoms of diverticulosis is painless lower GI bleed. Painless lower GI bleed. So if somebody has diverticulosis, the main complaint that they will make is when they use the bathroom, they saw a bright red blood in their stool, or when they wipe, they saw what? A bright red blood in the tissue. Obviously, if you use the bathroom and you saw that there's a blood in your feces, obviously you're going to get panic, and then you're going to see a doctor. And then if you go and see a doctor and then present your complaint, for the doctor to find out that really there was blood in your feces, doctor is going to perform what is called rectal exam. So when the doctor performs rectal exam and doctor finds out that there is bright red blood in your stool, the main treatment that the doctor is going to give you is what? Increase fiber in your diet. If increase fiber in your diet, and then what? The constipation goes away, obviously the pressure in the colon is going to decrease. When your bowel movement increase and the pressure in your colon decrease, it causes the wall basically to move back to where it was, and then eventually what happened? The lower GI bleed what? Decrease. So the main treatment for diverticulosis is what? Increase fiber in your diet. If you increase fiber in your diet, obviously the lower GI bleed manifestation will go away. All right. Now, continue? Yeah. Okay. Now, if you have diverticulosis, and then if you don't adhere to a medical treatment or medical recommendation, medical regimen, diverticulosis will lead to diverticulitis. All right? So diverticulosis will lead to diverticulitis. And the complication of diverticulosis is diverticulitis. There's a difference between osis and itis. So diverticulitis is a complication of diverticulosis. So anybody that has diverticulitis, they previously had diverticulosis before they had diverticulitis. So diverticulitis is inflammation of the colon. So inflammation of a diverticula leads to diverticulosis. So what happened is, I said earlier, if you have diverticulosis and then if you don't follow a medical regimen, now as the wall of the colon continue to add purge, right, you're going to have a lot of feces stuck up in the diverticula, and this will get infected, and that will lead to diverticulitis. So when somebody has diverticulitis, what is a common presentation of diverticulitis? Fever. Now anytime somebody asks you any type of condition that you see that inflammation is the cause, itis is inflammatory mediated, so be the first thing to say fever. So diverticulitis causes fever, and diverticulitis causes lower, left lower quadrant pain. Left lower quadrant pain. Diverticulitis causes nausea and vomiting. So these are signs and symptoms of diverticulitis. So if somebody has diverticulitis, they come to the hospital. Now based on the presentation, as a nurse, your nursing priority will be NPO, nothing by mouth. Anytime somebody comes to the hospital and they're manifesting nausea and vomiting, the first priority is what? Nothing by mouth. And they're obviously going to do assessment. And then to diagnose diverticulitis, let's say in the NCLEX, they ask you about blood work of diverticulitis. Now obviously blood work is going to show increased WBC, white blood cell count. Now diverticulitis is mostly caused by bacterial infection, and therefore among the WBCs, the one that will be highly elevated is neutrophils. Now we know from AMP1 and 2, the neutrophils are the first WBC that tend to go to the site of infection. Now, but to diagnose diverticulitis, doctor will order a CT scan. So the CT scan of the abdomen, that will show that the colon is inflamed. Now to manage diverticulitis, so this is how diverticulitis is managed. So we said first is what? NPO and then IV fluids. Now it's always good to give a normal saline. We know that normal saline is 0.9% sodium chloride. Now if the client continue to experience nausea and vomiting, doctor will recommend anti-emetic drug. So doctor can recommend ondansetron or Reglan or metoclopramide, and doctor is going to give what? IV antibiotics to cover the inflammation or the infection, and then you have to monitor for rupture. Now because the colon is inflamed, it will be fragile. If the fragile diverticulum ruptured, it will lead to peritonitis, and that could lead to death. So this is how diverticulitis is managed. The NCLEX might ask the question that if somebody has diverticulitis, is it good or bad basically to put anything in the rectal area? Obviously it's bad because the colon is fragile. Even rectal exam or even colonoscopy or even enema can cause the colon to rupture, and therefore avoid what? Placing anything in the colon, and that can cause the fragile colon to rupture, and that could lead to peritonitis, and that is a medical emergency. Also, if somebody has diverticulitis, they might ask you about diet. Now, in the acute phase of inflammation, patient has to eat low residue diet, no high fiber diet. Okay, so low residue diet is the diet that the patient has to consume while the patient is in hospital. But when the patient recover, right, when the patient recover after several months or several days or several months, the patient can go back to consume high fiber diet so that they wouldn't develop what? Diverticulosis. So my advice is, in the acute phase of the inflammation, the patient don't consume high fiber diet, but rather low residue diet. And as a nurse, it's also important to monitor for rupture, because the fragile colon could rupture. When it ruptures, it could lead to peritonitis, and that is a medical emergency. Thank you.